In some people with lymphedema, the affected limb can swell and become vulnerable to infections. If you suspect lymphedema, what are practical ways of coping? Joining me in the studio to help answer that question is foot care professional Audrey Wall. Audrey, last month we talked about lymphedema. It's such a big topic that we need at least part 2 of this discussion. What can be done if someone is living with lymphedema?
Well, thank you for having me back. And I think we could have part 365 and never really fully dig into it. However, it is a great topic to talk about. People live with lymphedema every day, 1 million Canadians every day. So one of the things that people say, well, I don't know if I have lymphedema, I'll say go to your doctor. Okay. Talk to your doctor. They might not know too much about lymphedema, but they might be able to help you navigate to find somebody who could help you.
Okay, Audrey, diagnosis is the first step.
Yes.
What is the next step?
The next step is finding a way to navigate through things that might help you. So when you have lymphedema, one of the things that can really help is a decongestive therapy of some kind. There are manual lymph decongestive therapists who are often massage therapists or physios who've gone and done extra education in how to do that because it's a very specialized kind of massage. But what it does is it helps reduce the congestion in the associated body part. There's also pumps. They're called sequential pneumatic compression pumps with a special sleeve with baffles that you can use to decongest your limb. But then you want to put on a garment that is designed to keep the limb or the area from swelling and becoming heavy and uncomfortable and painful.
So with the swelling of the leg, how can someone best take care of their foot and their toenails and that sort of thing?
That's a great question. It's so multifaceted because if your legs are affected by lymphedema, bending at the waist becomes a problem, bending your knees, bending your ankles, all the joints become a problem. And then sometimes the foot itself is affected, so it becomes a little bit harder to reach the toenails to see where they start and stop. The skin can become itchy, it can become tight feeling, so you want to avoid scratching at anything that itches. Making sure your limb is nice and clean. But not scrubby. Okay, this is just gentle. Always making sure that your toenails are trimmed. Now, the safest way to do that is to file them. Don't take sharp things to your feet. No X-Acto knives, no pliers, no side cutters, no kitchen scissors, okay?
And people have tried this, right?
Yes, those are all personal experience that people have told me. Because they just can't reach.
Right.
So seeing a foot nurse is obviously going to be helpful because we can sit down at the end of your feet and actually take care of them. It's like getting your hair cut. You could do it yourself, but do you want to? I don't know. Some people do a good job, but that's just not me. Making sure your skin is intact. You don't want an ulceration or a break in the skin. Using a lotion is really important to stay moisturized, but it's important that you choose a lotion that is okay for garments because some lotions can kind of get in the weave of a lymphedema garment and kind of bung things up. Petroleum-based emollients and things are probably not a great idea. And 2, something that is greasy can really eliminate the ability to pull that garment up, right? There's lots of useful aids that we can help a person with, but making sure that the foot stays protected. Wearing shoes, finding good fitting shoes with lymphedema is very difficult. And I'm going to tell you, they're not all attractive looking. So it's very hard. You know, there's a lot going on when you have lymphedema, body image wise, self-esteem wise, and then even just navigating a system that is not designed for prevention or maybe doesn't understand what lymphedema is.
And maybe the shoes and the bands and it's not the best looking thing, but it's going to help, right?
Yeah, it will help. The problem is that, you know, I like shoes. I love shoes. And if you offered me some of the available shoes, I would really have to grit my teeth and wear through them, reminding myself that it is important. But, you know, let's say you're a child with lymphedema or you're a teenager with lymphedema, that's going to be a hard sell. So if there are shoe designers out there, I'm saying put your best creativity to work because we need shoes that form and function marry well. Because here it's about function, but form is important.
And you brought up a very good point, Audrey. lymphedema isn't just something that affects older people, it's all ages.
It's all ages. Because there's two kinds of lymphedema. There's primary and there's secondary. Primary is something you're born with, something in your genes, in your lymphatic system just isn't working the way it could. Secondary lymphedema is due to a trauma, a surgery, something that happened to you to create this condition. And there can be children with lymphedema, there can be 100-year-old people with lymphedema. It generally affects women more often than men, but men get it as well.
I know we're just scratching the
We
surface
are
here,
just
which we're not
scratching it, yeah.
supposed to do. But let's have you back next month and continue the conversation on lymphedema.
I'd love that.
Thanks, Audrey.
Thank you.